Welcome to the Vitality Cast webinar. This is Dr. Dan Davidson. I'm your host today for Vitality Cast, sponsored by thevitalitydepot.com. We have a great topic today, SpiderTech Kinesiology tape. I know I've used it in my practice for the last 2 years, and it's just transformed my practice. Fantastic addition to clinical practice. And we are honored today to have the creator of SpiderTech Kinesiology tape himself, Dr. Kevin Jardine. Dr. Jardine, welcome to the webinar today.
Thank you very much, Dan, and I'd like to thank Vitality Depot for having me come on and present to your audience. Hopefully they'll be able to gain some insight in how kinesiology taping can enhance their therapeutic outcomes that they're trying to achieve with their patient base. And we're going to talk a little bit about certain conditions that can be helped with SpiderTech. Obviously, we're not going to be able to touch on all of them because, as you'll learn, there's a vast array of things that can be benefited by with the application of kinesiology tape. And we'll try to break some myth that people have with taping, and we'll try to give some insight into how they can better achieve some of the outcomes for difficult conditions that they may be seeing within practice. We're all attending this webinar today, and like most, we want to have some level of practice success. We want to see our practices go up. We want to see more patients, and we want to ultimately get our patients better and get them happier so they end up referring more patients. But often we hit some hurdles along the way. You know, it's difficult to go out there and see a number of different conditions and get results that are consistent, and often we end up kind of doing the same thing over and over. We end up seeing the same types of conditions, and we end up using the same types of strategies. And you know what the old saying is, if you keep doing what you've always done, you'll keep getting what you've always got. So an alternative to that is going out and getting new skill sets, learning new techniques, adding another tool to that toolbox. So when we do that, we often run the risk of juggling too many marbles. We end up having too many techniques and not sure exactly where they fit and how we can benefit the most from them. Well, that ends up being that same type of case that, you know, we try to put more in our heads. We often end up being more confused than when we started. Hopefully we're not going to end that way with today's little webcast. Hopefully I'm going to shed some insight on how taping can actually be very effectively and very easily implemented within your clinical practice. So where exactly does kinesiology taping fit within your practice? For a lot of you, this is going to be a bit of a break in the road from what your current thoughts are on taping. We're going to switch your thoughts that thinking of tape purely within an athletic realm and trying to get you to see that tape can actually be used for a number of different patients, for a number of different conditions across a wide age span. Here we have an actual picture of a patient in one of the trials that we're doing in one of the hospitals in the U.S. with a chiropractor medical doctor. And they're using tape in that environment with a lot of success. So we're hopefully going to be getting some of that data back later on this year. For a lot of you, you think of taping in that traditional structural format. You know, the tape is there to restrict or impede motion. It's there to be an immobilizing, structure. And we need to really think outside of that box and think of kinesiology taping more on the neurological and neurosensory type realm. And there are a number of different mechanisms for which the tape is capable of having a neurosensory input to achieve a therapeutic output. And a lot of those we'll go through with other educational webcasts to shed some insight into how those mechanisms occur. So what conditions can I treat with the tape? As I mentioned, they're vast, and there's a number of different conditions that we can actually influence with the taping applications. And we'll profile a few here. This is an example of just the spectrum of patient care that you can actually treat. A lot of people are unfamiliar with some of the capabilities of the tape, and treating different pediatric clients can be quite successful with the tape. Here we see a picture using the tape for torticollis. And that is one condition that the tape works very effectively with within an infant or a young adolescent age group. Here we see a picture of the upper knee spider. This is actually a pre-cut knee taping application, but it's used in this young adolescent to try to prevent tilting and winging of the scapula and to bring the shoulder blades back. So it becomes a very effective postural taping strategy. This also highlights that a pre-cut strategy to kinesiology taping does not need to be a cookie cutter approach. Once you understand what the tape is doing, then you're better positioned to be able to go through and apply the tape in various different ways for various different clinical conditions. Once again, this one that you're looking at now is the knee application that was specifically engineered for the knee, but if we understand what we're trying to achieve with the tape, it becomes a very, very effective application for a number of different areas. We can also use it with our aging population. We all know that there's significant hurdles that we're facing with treating an aging population with osteoarthritis and aches and pains that are surmounting their ability to be seen through traditional healthcare models. And we're prime positioned to be able to help address their aches and pains in a non-invasive, conservative way. And the taping can actually help with that specifically in that there's a product called SpiderTech Gentle that is specifically formulated for the fragility of collagen of geriatric skin. Here we see it applied in a low back taping format for an elderly client. And one of the things that I have found personally with this tape is that if I have clients that have any level of irritation with wearing any type of tape, they have sensitivities to tape, instead of not using tape and having them achieve the benefits that the tape can offer them, I end up using SpiderTech Gentle in those scenarios. A lot of the times when I'm taping up young children, I'll use SpiderTech Gentle as well. And the adhesive in it is actually a water-based adhesive, so it's very gentle, very friendly on the skin. I treat a number of professional athletes, and in that scenario, I end up having to put tape on and take tape off actually multiple times in a day. So when I'm doing that, in order to avoid irritation on the skin, I end up using the SpiderTech Gentle products because it allows me to put the tape on and off in a much higher frequency level without getting any irritation on the skin. So now that we know that we can treat everything from the cradle to the grave as far as age span, now we're going to look at specific conditions. So when we take a look at acute conditions, we can often end up seeing patients with any type of acute muscle tearing. Now, this type of presentation, even if you have not seen it before, for a lot of practitioners, when somebody like this presents to their office, they'll often tell them, go home, wait until that goes away, and then come back in. And they're missing the opportunity to start that therapeutic relationship with that patient off on the best possible way, with it, which is providing them relief. And that big purple ugly spot on that leg is like battery acid to the nociceptors. It creates irritation to the musculature, and it helps to exacerbate the condition and the discomfort that that patient feels. So an effective taping strategy that we would use for that is utilizing lymphatic applications. Now, SpiderTech does offer the most complete line of kinesiology taping products, ranging from rolls to pre-cut strips to full pre-cut applications. So really the choice is yours which type of product you're going to use within your practice. But one thing I can tell you, when you do take a look at an application like this, if you were to spend the time to try to cut and replicate this within your practice, you're losing very valuable, very precious time from both your time and your patient's time. So using a pre-cut gives you that standardized approach, but it also gives you the efficiency and the effectiveness that you're looking for within a busy practice. And with that previous screen that we saw, right there, this is that client 2 days later. I know this may come as a shock for some of you. You can see clearly underneath where the tape was, no bruising. And where the tape wasn't, there's still bruising. So it's not natural history. It is the application of the tape itself. that has the specific effect on improving and accelerating the outcomes of this patient. And when your patient sees this 2 days after they presented with that ecchymosis in the tissue, they're going to be very, very happy with what you're capable of doing for them. And when they're happy, they're going to tell lots of patients. Here we see an example of the tape being used right after an operation for stabilizing the ankle, and the tape can be used right away to try to help with any type of swelling, edema, or bruising. So even if your patient isn't experiencing an acute trauma like muscle tearing with this type of ecchymosis that we've shown here, and it's more osteoarthritis, you can still use the applications with a lot of success to try to reduce that swelling and edema. If you have a patient that walks into your office with a rolled ankle and it's big, purple, and ugly, you need to get rid of big, purple, and ugly. And kinesiology tape can very effectively do that. Here we see a common presentation that most would see within their practice, somebody presenting with neck pain. But in an acute case, if this was whiplash-associated disorder, if this was a client that comes in with a very sensitized, very irritated neck, often the best place to start is not at the neck itself. Often the best place to start is actually through the back. If you can properly stabilize and position the scapula in those conditions, it will actually allow the head proper position to be able to retract to alleviate some of the stress. That way it allows it to calm down effectively before you start going in and working on those tissues. Or even while you're working on those tissues, having this tape application there prevents rounding forward of the posture and the shoulders, increasing that mechanical stress and strain on those tissues within the neck. And for patients that just have irritation in through that periscapular area, this application is very effective for that. Doing your adjustments, then putting this type of application on, is going to allow your adjustments to hold much longer than you were capable of before. Going back to that whiplash case, if we end up taking those lymphatic applications like we saw earlier, we can easily apply those over the cervicothoracic junction to help reduce some of that swelling and edema that may be present in more significant cases of motor vehicle accidents and whiplash-associated disorder. If we're looking at a shoulder, we can actually apply what you see in front of you, which is the hip spider. So this is the hip spider designed for the hip, but once again, we can apply them in various different areas. So this application is actually intended to prevent anterior translation of the head of the humerus. It's to keep the shoulder girdle in proper positioning to try to reduce the stress and strain on the glenohumeral joint and even on the AC joint during elevation. This type of application is applied in what I would teach as a structural application. Now you can take numerous different courses to learn how to apply the tape. Some of them range from trying to learn how to apply the tape from one direction to another to evoke a change, which is currently completely invalid as far as the mechanisms behind how the tape works. SpiderTech offers a one-day certification course you can go through with trained professionals in clinical scenarios for different conditions and learn how to apply the applications based on an evidence-led model of how to use the tape effectively within practice. You'll also learn applications like this where they're outside of the box, that you can use the tape in various different areas to achieve the outcomes that you're looking for. Chronic pain would also be something that we would use the tape for. And the most specific thing that we would actually use kinesiology tape for. It really is the type of condition that separates kinesiology tape from traditional forms of tape and really makes kinesiology tape a therapy and not just tape. If we have somebody with chronic low back pain and they walk into your office, well, it doesn't matter if that condition is a disc injury or a facet injury or a myofascial strain of the lumbar spine. I would end up putting the tape on in the exact same way. Now that sometimes is a difficult statement to understand because the variables that are involved with those different conditions, they're all very different. But they do have a common thread, and that common thread is nociception. And nociception to the central nervous system enters intersegmentally into the spine, then it actually traverses to higher brain centers where it then becomes pain. Once that happens, there's neuroprotective mechanisms that kick in, which cause alterations in muscle tone and in how the muscles are able to fire, the sequence for how they're able to fire. We've all heard about chronic low back pain and multifidi and transverse abdominis and how those muscles are not activating. These are the neurological reasons behind that. This also lays the foundation for how the tape is so effective at treating chronic conditions. The applications that I would end up using in that particular case for either of those conditions, whether it was disc, whether it was facet, or whether it was myofascial, would be the low back spider. Here you see an example of it with two large pieces going up the paraspinal muscles on both sides. Then you can see different application pieces or projections coming out towards the armpits. Those are more for the lats. There's no low back or upper extremity condition that doesn't affect the lats. And this type of application, it's also important to highlight, not only does it give you a standardized approach for application, but as that patient moves, because that piece is cut out of one continuous unit, that whole unit moves together, very similar to how your fascial system would function. So it becomes much more functional as well. Here, once again, we see the SpiderTech Gentle in a more geriatric client. Dealing with chronic SI joint problems can often be an issue. With kinesiology taping, they can help you overcome those issues. Here we would see taping for the glute max, keeping in mind that with SI joint problems you have force closure, which is included with the glute max and the paraspinals and thoracolumbar junction. So in order to make sure those muscles are functioning properly, using something like kinesiology tape can help you achieve that. And here we see the groin spider or the adductor spider, which is placed on the glute max in order to make sure that the glute max is firing at its full capacity. And then you would pair that with the low back spider to really influence paraspinals and the glute max all at one time. And for some very chronic SI joint problems, you can resolve them even in as little as a couple of hours after you put this on. So you do your adjustments, do your treatments, put this type of combo application on, and it is very effective with your SI joint problems. For those of you who are still contemplating whether or not kinesiology taping is a part of their practice future, take the low back spider. Take your most difficult, challenging low back pain patient and put that low back application on them. You can watch videos for free on the SpiderTech website and on Vitality Depot. You can watch how to apply it for free, apply it, and have your patient tell you the type of success that you're going to see in your future if you incorporate kinesiology taping. Shoulder conditions, those are often some of the more complex things to treat. But if we have any type of irritation to the rotator cuff or any type of subacromial impingement, we can end up using something like a full shoulder spider, which was functionally designed to include the infraspinatus, the deltoid, the supraspinatus, the triceps, and the biceps. So that it's a full unit that incorporates all of those muscles that are involved with rotator cuff function. We could also see how we could use pre-cut strips. So here are some X and Y strips that SpiderTech has in a pre-cut format that you simply take out of the box and apply. These were principally designed for pediatric cases, but you can also use them on very small adults, or you can use different combinations to try to achieve some of the full pre-cut applications. Posture obviously is something that we all struggle with within practice with our patients. It's very difficult for them to maintain good posture, and no matter how hard we harp on them and tell them that their posture sucks and try to sit up, they're still going to go out to the car, sit behind the wheel, and slouch. So some alternatives that we have now is utilizing tape. The tape can become that extension of you, trying to inform and remind that patient that good posture is ideal, and that every time they feel the tug of that tape, that they're actually hindering proper posture, and they may be straining some of those areas that are leading to their condition. I use this quite a bit with my pediatric and adolescent athletes. I put this tape on them, and I tell them that every time they feel the tape tugging, they're robbing their performance. And it brings context for them. It brings an understanding. They can feel it. So every time they come back to me after I've done that, they often say, wow, I really robbed a lot of my performance. And then they have the interest to try to improve their posture. For your adult patients, putting this application on is very effective for them. It really acts as helping against that tug of war that we constantly play against gravity. So it gives that extra little bit of support. It makes the clients a little bit more aware that they have to maintain better postures. And even subconsciously, it helps develop that kinesthetic awareness, that stimulation, that cue to maintain better postures and better positions. And it allows it to do so nonstop, because the tape, once you apply that postural spider, it stays on for 5 days. You instruct your client to leave that on during showers and during bathing, and the tape will stay on effectively. Then they come back in and see you, and you end up putting more on. Here we see examples of 2 hip spiders used for larger people, that you would end up, instead of using the postural spider, you could use 2 hip spiders if you want more support and the person is larger. So ultimately, once that's on and you've engaged them in some type of process where they're stretching and strengthening those muscles to coincide with the taping, the sarcomeres in through the front of the chest are actually going to lengthen. And the sarcomeres into the rhomboids are going to shorten. Now, how long that time frame takes, we don't exactly know. But what we implement is a postural performance program where we end up putting those applications on, we end up giving them some exercises and stretching, and the patients come in every 5 days and put a new application on. And I can tell you I see amazing results with my patients' postures and how they change for the better. So ultimately, we end up using kinesiology taping to really try to reduce pain and decrease and modulate nociceptive influence to the central nervous system. We want to restore and improve and normalize muscle activation. We want to restore and improve range of motion. And we want to overall have a faster rate of healing for our clients. If we can achieve what's on this slide, what's on your screen, in a faster, more efficient way, our patients are going to get better sooner. We're going to meet their expectations. They're going to be happy to send other people to you. And the tape really creates an incredible value-add situation for your interaction with your patient, in that your patient now leaves with an extension of your treatment. You're treating them, and then that tape becomes an extension of your hands. They're leaving with that valuable input that's constantly helping them to try to improve and overcome their injury for which they came to you for. And ultimately, in today's clinical practice, time is very important. So choosing a standardized pre-cut model definitely has efficiency built into it. You're able to put the applications on and not have to remember how to cut and apply each individual application for every area of the body. SpiderTech has taken that and they've done it for you. But if you still need to use rolls, and if you want to use strips and create different applications to give more of your unique input, you can certainly achieve that as well with SpiderTech products, as SpiderTech provides the most comprehensive approach to kinesiology taping and education. I'd like to thank you for joining me today. I know that there are some questions, and I will let Dan take over and take some of those questions, and hopefully we will be able to answer those for you.
Thank you, Dr. Jardine. Great presentation. I always learn every time you do present. And we do have several questions. Here's a question. What are some general guidelines to the number of applications or the times that you would recommend to a patient, just in general based on certain conditions? Pretty much how many times should you do it in succession?
That's a great question. It's a difficult question in that there's so many different variables that it really depends on each presenting case. If somebody has tweaked their back just trying to shove an oversized carry-on bag into an overhead compartment on an airplane, and they got a little bit of an ache in their QL, then even one application can really see them through that and overcome some of the hurdles. If you're dealing with a patient that has chronic osteoarthritis or stenosis of the lumbar spine, those patients, it may be actually an ongoing, non-invasive, drugless way for them to achieve some relief and be able to stay a bit more active without the discomfort. So they may be using the products a little bit more frequently, and they may be using them a bit more long-term. With the postural one, we typically choose 12 weeks to go through that cycle. Okay. Because we're influencing the nervous system, and it takes time to change. And we're also influencing connective tissue, trying to get the rhomboids to shorten, trying to get the pecs to lengthen. And based on other models of understanding how long it takes connective tissue to change, that's why we built that 12-week model. So it really does depend on each patient. And as you become more familiar with kinesiology taping, you'll get a better handle of the prognosis of how many applications you'll be able to apply for each patient.
Okay, here's another question. I just wanted to know a suggested explanation for patients about how kinesiology tape works and especially how it helps complement the chiropractic adjustment.
What I typically tell my patients is that the tape really acts as an extension of my hands, and when it's applied to their skin, it actually acts as an extension or a replication of touch. And we all know that if we bang our elbow and our first inclination is to try to grab it and rub it to make it feel better, the tape really, in its most simplistic way, is achieving that by stimulating certain neural receptors in the skin. So for my patients, I basically tell them that it is an extension of touch, it is communicating with the nervous system of their body, and it's allowing them to reduce the discomfort they're feeling and to ensure that they're able to get around and get mobile and resolve their condition at a faster rate than if I didn't use the tape. And for different conditions where we're talking about postures, I use the tape as an analogy that it is acting like an extension of my hands once again, but I'm telling them that it's helping to hold positions that otherwise the patient is not strong enough to maintain on their own. So that the tape really helps become, their little helper to keep those positions from getting stressed and strained, and they're constantly out there fighting the battle against gravity.
Excellent. Now I like the way you put that. Another question, maybe you can just comment in general on any research that's been done over the most recent years on kinesiology tape, as well as possibly SpiderTech in improving some clinical outcomes with certain conditions.
Yeah, there's actually an abundance of research that's being performed right now. Some of the latest stuff has come out, and there's about 7 or 8 papers that came out last year. Great stuff that's coming out. We're doing about 5 RCT trials, clinical trials with the tape in a standardized pre-cut format. Because the standardized model also helps to validate the research, because it's better to have that standardized approach when doing the clinical trials.
Sure.
But there is an abundance of research that is coming out. Part of it's my push into the market to really understand the mechanisms and to present a more evidence-led approach, and that's what we try to teach through Collaborans, which is a more evidence-led approach to understanding some of the mechanisms behind taping. And we try to get out there that there are neural influences. It's not trying to replace fact with fancy and try to come up with elaborate ways that you have to apply the tape that you don't have to try to explain with science.
Okay, and then the last thing I was going to ask you to comment on. Certainly, we appreciate the partnership with Vitality Depot. And we've just seen, great results with thousands of doctors and patients getting results. Your advice to a doctor who is just starting and maybe they've used kinesiology tape with the rolls in the past, but they've maybe never used it pre-cuts, maybe some advice on kind of how to start and get started. But also, if you could comment, I know Vitality Depot has partnered with you. We have a website, SpiderTechOnline.com, where we have all the videos for all the 17 different applications, as well as the e-learning module course that you put together. And I thought maybe you could just briefly describe that as well.
Yeah, we've tried to make the education and the integration of kinesiology taping as easy as possible. I mean, what we were concerned with was enhancing the benefits in the clinical practice of busy docs out there that really can benefit by using kinesiology tape. And we offer that in a number of different ways. As you mentioned, on the portal through the Vitality Depot, you can watch the videos of how to apply the standardized applications free of charge. Free of charge. Vitality Depot is not charging you anything for that. Then you can actually access an incredible online program that really goes through with a bit more detail some of the mechanisms behind kinesiology taping. Once again, free of charge. So you can understand some of the concepts, so you get that spark of interest for wanting to include this in practice. And then you take that the step further and you engage in courses. You can contact me for details. My website or my email is in front of you. You can contact Vitality Depot for information as well with regards to courses. And we can instruct you on the best ways to learn what you're really trying to achieve. Now when it comes to using kinesiology tape, the most difficult thing that I find out there is not really how to apply a shoulder spider or understanding the sensory gating mechanisms behind how the tape works. The most difficult thing is changing practice habits that you currently do day in, day out. That's the most difficult thing. So with taping, it's like anything else. You need to get your hands on tape and you need to start taping your patients in order to improve your skill sets and in order to start seeing the benefits that you can get. Now there's a couple of different ways that I think Vitality Depot is very unique in what they've offered their clients. One is you can go for their full kit, in which there's approximately about 45% savings off of buying things individually, which is incredible. And I think what they're trying to do there, and Dan can maybe elaborate, but I think what they're trying to do is they're really trying to get you to see that the results are pretty amazing. So they're trying to give you a bulk package that you can end up getting with incredible savings and start getting you practicing with the material so that you start seeing the results. So that's one option. The other one is for practitioners that want to enter it a bit slower, they want to see what the results are, then my suggestion would be picking one application that you really see a majority of conditions for. And then let's say for it's low back, then you would end up getting about 20 spiders, just the low back, and over the next 2 weeks, apply a low back application to every single one of your low back pain patients. And then you will see yourself. You'll be able to see with a large enough patient base what the results are that you can end up getting, and they are pretty amazing.
Yes, the Vitality Depot does have several kits. Our most popular is the starter kit and our spine kit, and they give you, samples of all the applications, and especially the spine kit kind of gets you front-loaded with those applications that you may be more apt to use in a chiropractic practice, lumbar, neck, hip, spiders, that type of thing. But you've got a little bit of all of them. And in our practice, and I'll just share my testimony, Dr. Kevin, is that we've been using it for over 2 years now. And as you said, at first, we tried it on a few patients. What we found is we started using them so fast we couldn't even keep it in stock fast enough. And so now we have the clinic pack where we have the slide-out, storage units that for all 17 applications. I want to make sure that I have every application in my office at all times so I can best serve my patients. And so we have totally integrated it into our office, and it's become a very foundational part of our clinical care from the very first day a patient comes in our office. So those are some ideas to consider. And again, Dr. Jardine, we want to thank you for the great presentation and for coming up with the idea and follow through with SpiderTech. I know it's been a great blessing to many people.
Excellent. My pleasure, and thank you very much, and thank Vitality Depot and Mark for me, okay?
Sure will. And just as a reminder, Vitality Depot is here to help serve the profession and help you serve your patients, but also help you learn. And that's why we've committed to our weekly Wednesday webinars at 2 p.m. Eastern Standard Time. You can go to vitalitycast.com to look for upcoming webinars, as well as have access to all our archives, including this webinar, which will be just a link away for an archive if you want to review that and or share it with your staff. I would suggest it'd be great to show some of our webinars for a staff meeting and just to continue the education with your staff. Also, our main website is vitalitydepot.com. So again, thank you for attending, and thank you, Dr. Darjean, for a great presentation. Hope you have a great, healthy day today. Thanks so much.
Thanks.